Here are some troubleshooting tips to manage your catheter when you go home. You may notice blood in your urine while the catheter is in place. If the urine color is lighter than cranberry juice, please increase your fluid intake, which may help lighten the color of the urine. If the urine color is darker than cranberry juice, is thick in consistency like tomato juice, or you are passing several large clots through the catheter, please contact your physician's office or visit the local emergency room. If you notice there is no urine draining into your bag, take the following steps. Check for and remove any kinks in the catheter or the drainage bag tubing. Form-fitting underwear can sometimes cause kinks, therefore, males are advised to wear loose-fitting underwear. Check that the leg bag straps are fitted correctly and are not causing drainage bag obstruction. Check the position of your catheter and drainage bag. Ensure that the bag is positioned below your bladder when you are lying, sitting, or standing. If you are not experiencing abdominal discomfort or the urge to urinate, increase your fluid intake. Drink 2 glasses of water immediately, and if there is no urine drainage after 30 minutes, contact your treating physician or go to an emergency department. You will need to visit your local emergency department immediately if you have performed the above checks and you have abdominal discomfort or have a strong urge to pass urine and feel bladder distension. In order to troubleshoot urine leaking around a catheter, please check for and remove any kinks in the catheter or drainage bag tubing. Avoid constipation. Eat a balanced diet and drink 1.5 to 2 liters per day unless otherwise advised by your doctor or nurse. You will need to visit your physician or emergency room if your catheter continues to leak. The catheter can be replaced with a new catheter that is larger, or volume may be taken out of the balloon. If you are experiencing bladder spasms, some medications may be prescribed to relieve the bladder spasms. Bladder spasms are contractions of the bladder. They are commonly caused by urinary tract infections or irritation from a catheter. Bladder spasms can be painful and often lead to an urge to urinate. Incontinence may occur if the bladder spasms continue because the contractions will force urine out. While this is not a dangerous condition, bladder spasms can be very uncomfortable. If you are experiencing bladder spasms, please contact your doctor or nurse who will be able to give you further advice for treating the bladder spasms. If you notice that your urine is cloudy, foul-smelling, or discolored, and you have pain or discomfort, you may have a urinary tract infection. The signs and symptoms of a urinary tract infection are cloudy, strongly offensive-smelling urine, burning sensation around the catheter, bleeding, itching and soreness, fever, fatigue, and discomfort in the lower back or loin areas. If you have any of these symptoms, please call your physician or nurse immediately. Your physician may need to send a specimen of urine to the laboratory for testing. You may need a course of antibiotics if you are found to have an infection. You should also increase your fluid intake unless otherwise advised by your doctor or nurse. Your catheter should not fall out because it is held in place by a small balloon which sits in the bladder. On rare occasions, the balloon may be faulty and deflate, which may cause your catheter to fall out. Sometimes a catheter may be accidentally pulled out with the balloon still inflated. This may be associated with pain and bleeding. Securing the catheter in place and making sure it does not get pulled out is very important. If you accidentally pull out your catheter, you must contact your doctor or nurse immediately or visit your local emergency department.